Quick note: this is an automated educational summary of public medical sources: Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Hi, and welcome back. Are you wondering what a rheumatoid arthritis factor test actually is, why your doctor ordered it, and whether you can order one online without a prescription? You're in the right place. Today, we're breaking down the RA factor blood test, what it costs, exactly how it works, and where you can get tested in 2026. We're pulling together what Mayo Clinic, the NIH, and Medline Plus actually say about this test, so you can have a real conversation with your doctor about whether it makes sense for you. Let's start with the basics. The rheumatoid arthritis factor, often called RF, is an antibody your immune system produces. But here's the critical part. According to Medline Plus and the Cleveland Clinic, having RF in your blood doesn't automatically mean you have rheumatoid arthritis. Some people test positive and never develop RA. Others develop RA without RF. The test measures how much of this antibody is in your bloodstream, shown in IU/ml. Think of it as one clue in a larger puzzle your doctor is solving, not a diagnosis on its own. When does your doctor actually order it? According to the Mayo Clinic and NIH, it's typically used when someone has symptoms suggesting an autoimmune condition, like persistent joint pain, swelling, or stiffness lasting more than a few weeks. It's also ordered to monitor existing rheumatoid arthritis or screen people with a family history of autoimmune disease. Doctors usually pair it with other tests like anti-CCP antibodies or an ESR to get a fuller picture. Think of it as part of the detective work, especially when something doesn't add up. Now, the cost question. Without insurance, an RA factor test typically runs $30 to $150 at most labs. The variation depends on location and lab choice. If you have insurance, you usually pay a copay or coinsurance, often $10 to $50, and your insurer covers the rest. Online lab services like Quest, LabCorp, Everlywell, and newer direct-to-consumer platforms typically charge $40 to $80 out of pocket with no insurance required. Here's the thing. Prices vary, so it's worth comparing. Many insurance plans cover it entirely if your doctor orders it for a legitimate clinical reason. The test itself is straightforward. A phlebotomist draws a small blood sample from a vein, usually your arm, in about 5 minutes. The sample gets sent to a lab where technicians isolate the serum and run it through automated analyzers. These machines look for antibodies against IgM. That's what the RF test specifically measures. Results typically come back in 1 to 3 business days. No radiation, no injections beyond the needle itself. It's genuinely one of the simplest blood tests doctors order. Your results come back with a number. What does it mean? Medline Plus and the Cleveland Clinic note that a normal or negative RF result is typically less than 14 IU/ml, though this can vary slightly by lab. Higher results suggest RF is present. But here's what's crucial. A positive RF doesn't diagnose rheumatoid arthritis. It increases suspicion, especially if you also have symptoms or other positive antibody tests. Some people with high RF never develop RA. Others develop RA without it. Your doctor will interpret this alongside your symptoms, imaging, and other tests. Can you order this test online yourself in 2026? Yes, in most cases. Quest and LabCorp both offer online ordering through their websites without a doctor's order. Check your state's rules first. You book an appointment, go to a local draw site, pay out of pocket, and access results online. Everly. Well and Let's Get Checked also offer rheumatoid panels including RF. Prices are usually transparent up front, so you can shop around. Important note, a positive or confusing result is still best discussed with a doctor or rheumatologist. not something to interpret alone. Should you order this test? According to the NIH and Mayo Clinic, consider talking to your doctor if you have unexplained joint pain or swelling lasting weeks, a family history of autoimmune disease, or if your doctor suspects rheumatoid arthritis or another autoimmune condition. Routine screening without symptoms or risk factors isn't recommended. If you already have an RA diagnosis, your doctor might order it periodically to track your disease or response to treatment. The key is, it's always a why conversation with your clinician, not a standalone decision.